Hello, in today's video we are going to demonstrate skills of estimating and grading pitting edema. But first, we'd like to talk about what edema is. Edema is a swelling caused due to excess fluid accumulation in the body tissues. So edema could be due to other conditions. So in the cardiovascular system, a condition such as heart failure could cause edema and is mostly seen on the legs. And then for renal failure, that is renal diseases, edema is first seen on the face. And then we have liver cirrhosis, in which the edema is seen on the abdomen. And then for the limbs, we have lymphedema, which is swelling of the lymph nodes, which is normally seen in either the upper or the lower limbs. And then edema could be seen on either parts of the body and could be caused by either pregnancy or some medications. Edema could be pitting or non-pitting. Non-pitting edema is when the skin does not retain a dimple or a pit when it's being compressed for some few seconds. And such conditions could be lymphedema or inflammation. And then pitting edema is when the skin retains a dimple or a pit when it's being compressed for a few seconds. Such conditions can be heart failure, renal failure or diseases, immobility, then some medications. So for the signs of edema, it is swelling or puffiness on the skin. And then the skin might look stretched or shiny. And then the presence of either a dimple, that's a pit, or no dimple. Good day, Madam Georgina. How are you doing? I'm fine. Okay, so during vital signs, I realized that your feet were a bit swollen. So I'd like to try and examine it. So I'll press against your ankle. So if you feel any pain, you're alerting. May I continue? Yes. Okay, thank you very much. With permission sought and privacy ensured, you then proceed to examine the legs. You make sure that there's adequate exposure of both limbs, and then you are looking at the patient for any signs of discomfort when estimating the degree of pitting. So first, you look at both limbs for symmetry, and then for signs of any tear or injury. And then you also look for the color of the skin, if it's pale, if there's any sign of cyanosis. Should the person have any inflammation or a sore, you should then wear gloves to do this examination. But since my patient has no sore or any tear on the skin and my hands are washed and sanitized, I then examine. So you then use your thumb to press either the medial malleolus for some few seconds and then release, or above the ankle and then you release. As you can see, you then massage the skin of the patient when you release also. As you can see, my patient has zero pitting edema. That is, there's no edema at all. But should the patient have, you then grade per the depressions. So there are 4 stages of edema.
Class 1 has 2 mm depression. There's no visible distortion. The class 2 has about 4 mm depression, and then there's a bit visible distortion, and then it lasts between 10 to 15 seconds. The class 3 is 6 mm visible color change, and then it lasts more than a minute. It's about 6 mm. Class 4, which is severe, has gross distortion and about 8 mm and lasts more than 2 minutes.
The examination on both limbs. Then you do it along the shin of the leg, up to probably the knee. After that, you cover the patient and you thank her for her cooperation. You then report your findings. So for my patient has zero pitting edema, that is, no edema is seen on the leg. So with a patient who has edema, you would elevate the limb, that is at the heel side, with the pillow. So to ensure privacy of the patient, I then put my hands under and then you ask the patient if she is okay. Madam Amy, are you okay?